Well, autonomic medicine is very interesting because it's like an octopus. It spreads through almost every neurological field. So from movement disorders to epilepsy to demyelinating disorders, neuromuscular, autonomic touches all of these, and it's one of them. So it's important for every practitioner of neurology to be aware and to know autonomic medicine. This project started 2 years ago and is a continuation of a project about the COVID and the impact it had in autonomic patients in the labs across Europe. We also capture differences in the previous projects about North and South Europe. And then this survey about education also has this look through the panorama, the overview of the education in autonomic medicine in Europe. What we were able to capture in this with this survey was first a geographical gap, dividing Europe in northwestern and then southern, eastern, and greater Europe countries. We found that the people from the south has much less opportunities of having education in autonomic medicine, although they also feel the need more frequently than the people from the north to have education in autonomic medicine. This is a very important issue since most respondents, and we are from the south of Europe, we also notice that they are very enthusiastic about autonomic, but they do not have the opportunities to have the education. Another important aspect was regarding the gender gap, because female participants also were also the younger population here, were also less confident, and also less opportunities to have the education, and feel much frequently the need to have the autonomic education. So this was the major differences regarding geographical gaps, regarding gender gaps, but then we also capture information about preferences in education. For example, the e-learning that arose with the COVID is an aspect that has to be worked, although people would like to have education in a lot of formats, different formats, including, for example, facultative or compulsory rotations or educational courses, and also reviews in neurological journals. These are some different education means of providing education that people would like to have. But in the end, we had this idea, and the numbers, the figures were very expressive, that people need to increase their knowledge and think that autonomic education is important or very important, because no one answered that there was no importance of, or that it was of low importance. It was these are expressive figures that were very interesting, and that will sustain future work. I think these differences, for example, between North and South, they reproduce a little bit the overview of and the differences of the clinical autonomic labs. So there are also these differences between North and South, much more labs that also translate into more opportunities of education. So education also comes with the platforms of clinical healthcare systems in terms of the autonomic labs. So not directly through education that is being provided, but also by a construction of healthcare providers, new labs. There has been a project in autonomic units, how to build an autonomic unit. Also, for example, for bladder issues, a NeuroGAD project is being in its final steps. So it is a big guideline about bladder and sexual issues that is planned to be published in brief. So some things are being made to improve education and improve healthcare in autonomic medicine in Europe.